children have for years been considered super spreaders of common winter bugs and the flu. But doctors say the same may not apply for coronavirus, according to research that suggests they are not major spreaders of the disease. An infected 9-year-old boy in France did not pass the vicious virus onto anyone despite being in contact with 172 people while contagious. The unnamed boy was at the center of a cluster of cases that made international headlines in February. He and 10 others were struck down while staying in a ski chalet in the French Alps as Steve Walsh, one of the first Britons known to have the virus. The child went to 3 different ski schools in eastern France while unknowingly infected, and mingled with other people. All of those were placed in quarantine when the child tested positive, but only one other child contracted COVID-19. Neither of his siblings was struck down. Doctors suggested the boy was not the spreader of the virus to the one other case because he came into contact with so many people. Researchers who studied the child's case said it suggests children are not a primary concern when considering the virus's main routes of transmission. This would mean it in stark contrast to other viruses like the common cold, which normally spreads rapidly among children. This is because youngsters often have poor hygiene and come into contact with lots of other youngsters, who have similar habits. Doctors have emphasized under 18s are just as at risk as any other age for picking up the virus but unlikely to show severe symptoms. The case of the 9-year-old boy was investigated by Public Health France and published in the U.S. journal Clinical Infectious Diseases. They explained how the boy had continued to attend 3 ski clubs while he was unknowingly infected. Through rapid intervention by health authorities, it was ascertained the child, who only displayed mild symptoms, came into contact with 172 people while sick. All of those were placed in quarantine as a precaution, and 41% had some respiratory symptoms. In total, 73 people were tested and each result was negative except one who came back as positive while in the hospital. The doctors ruled that the boy did not pass on the virus to the one case because of the large number of negative results of his tested contacts. Some 64% of those contacts tested positive for other seasonal illnesses such as flu. But no cases of COVID-19 appeared in the following 2 weeks. But because none of the other suspected cases were tested, it cannot be said for certain that the boy did not pass it on to any in that group. The researchers noted that even the child's 2 siblings didn't catch the virus. They said that the case of the child could suggest that children might not be an important source of transmissions of this novel virus. Other strains of the flu or respiratory viruses may be more easily spread between children, the team theorized. They added that if there are other viruses circulating among children, which is likely, these bugs could suppress the transmission of SARS-CoV-2. One child, co-infected with other respiratory viruses, attended 3 schools while symptomatic, but did not transmit the virus, suggesting potential different transmission dynamics in children. Costas Donis, an epidemiologist at Public Health France, and lead study author, told AFP. While coronavirus infections in children appear to be mainly mild, they are still capable of spreading the disease to older people at greater risk of serious illness. Dozens of countries have closed schools as they try to contain the COVID-19 pandemic in the hopes it will stem the spread of the virus to other households. Viruses typically concentrate on children because they come into very close contact with each other daily at nurseries and school. Officials expected the novel coronavirus to be no exception, which is one of many reasons why schools have been shut. Current evidence indicates that children develop COVID-19 less often than adults and the clinical manifestations of the disease are milder. The above suggests that children, being less likely to be infected and more likely to develop mild disease, may play a less important role in the transmission of this novel virus. The boy had initially picked up the bug while in a ski chalet in France's Haute-Savoie region. He was part of an early coronavirus cluster in the country which centered around a British man called Steve Walsh. Mr. Walsh made headlines in February because the 53-year-old was one of the first British people to be infected with the coronavirus. He had been to a business conference in Singapore in mid-January where he caught the virus. On his route home to Brighton, he stopped off for a ski holiday in the French Alps on January 24. Mr. Walsh, a father of two, spent 3 to 4 days in France with 10 British adults and a British family, 2 adults and 3 children. He tested positive for COVID-19 on February 6 in Brighton, after learning that he had been in contact with confirmed cases in Singapore. Brighton became the centre of Britain's coronavirus crisis in its early days, with 6 cases. GPs, schools, gyms, and nursing homes shut their doors as a result. 11 people who were with Mr. Walsh tested positive across the UK, France, and Spain. This included Britain's Bob Sainer and his wife Dr. Catriona Greenwood, who owned the chalet in France but live in Brighton. Their 9-year-old son also tested positive, but Professor Donies and colleagues did not explicitly say it was this child they studied. But they did write, all cases were adults, apart from one 9-year-old who attended 3 different schools and 1 ski class while symptomatic. Thank you for watching our video. Please show your support by subscribing to our channel and turn on the notification. Follow us on Twitter, Instagram, Facebook and Reddit for more videos.